Ever feel like you're just drowning in information? You want to get to the heart of some complex research, but you're just wishing there's a simpler way, a shortcut maybe, to really grasp what matters.
Yeah, it's a real challenge today, isn't it? And that's exactly why we do these deep dives. Our goal today is to, well, slice through that complexity. We want to pull out the key insights from a really important public health study just for you.
And it definitely is an important one. We're digging into some new, pretty comprehensive research on human papillomavirus, HPV, and the cancers linked to it. But we're narrowing the focus quite a bit, looking specifically at one region, Appalachia.
Right. And our main source here is a study, an original investigation published very recently in JAMA Network Open. That's a top-tier peer-reviewed journal, so we know the research is solid.
Good to know.
It's co-authored by people like Todd Burrows and Chrysalie Lancouz, among others. And what makes this study really stand out is that it's the first time anyone's done a comprehensive look at all the HPV-associated cancers across the entire Appalachian region.
The entire region.
The whole thing. Using data that covers remarkably about 99% of the U.S. population.
Wow, okay, that's huge. Not just a small snapshot then.
Not at all. So with that stage set, our mission now is to unpack what they found, try to understand the why behind it, and importantly, explore what it all means for public health.
Great. So let's start with the context. Appalachia.
Yeah.
What should we know about this region?
Okay, so Appalachia isn't just, a loose term for some mountains. It's actually a federally defined area. We're talking 423 counties across 13 eastern states.
Huh. I didn't realize it was that formally defined.
Yeah, and historically, it's a region that's faced, well, significant socioeconomic challenges.
Yeah.
And unfortunately, that often translates into poorer health outcomes compared to the rest of the U.S. That's kind of the backdrop here.
Got it. A region with existing vulnerabilities. And the health issue itself is HPV. Maybe a quick refresher. What is HPV and how does it connect to cancer?
Sure. So HPV is a really common virus. Many strains exist, but certain ones are known to be linked, strongly linked to specific cancers.
Which ones?
We're talking about cancers of the oropharynx, that's the back of the throat, plus the anus, vulva, vagina, cervix, and penis.
Okay.
Now, the good news is we have very effective vaccines against the most common cancer-causing HPV types. The challenge, though, is vaccine uptake. If people don't get vaccinated, especially in certain populations, the protective effect is, well, obviously much lower.
Right. Vaccination is key, but uptake varies.
So this study wanted to compare the cancer burden, Appalachia versus non-Appalachia.
Exactly. That was the core objective, to really quantify the difference in HPV-associated cancer incidence.
And how did they go about doing that? What was the method?
They use what's called a cross-sectional study design. Think of it like taking a really detailed snapshot, or maybe more like a census, of cancer cases over a long period.
Okay.
They capped into the U.S. Cancer Statistics Incidence Analytic Database, massive resource. This let them look at diagnoses from January 4, 2004, all the way through December 31st, 2021.
It's a long time frame, almost 2 decades. It is. And for each case, they examined factors like, age, sex, race, and ethnicity, where the person lived the county, whether it was urban or rural, which they call urbanicity, and crucially, the stage of the cancer when it was diagnosed.
So lots of variables.
Yeah, all that data allowed them to estimate the incidence rates, how often these cancers occur, and track how those rates changed over that whole time period.
Okay, let's get into it then. The findings.
Yeah.
What was the big headline number? The overall disparity.
The headline is pretty stark, actually. Between 2017 and 2021, just that 5-year snapshot, the overall rate of HPV-associated cancers was 16% higher among people living in Appalachia compared to those living outside the region.
18%. That feels substantial.
It really is. We're talking about almost 24,000 cases diagnosed in Appalachia just in those 5 years. It clearly points to some significant underlying issues.
Wow. Nearly 24,000 lives impacted. Did they break that down by sex? Were there differences between men and women?
Yes, they did. And the patterns were distinct. For Appalachian females, the incidence was 18% higher than for non-Appalachian females.
18%, even higher than the overall average.
Exactly. And cervical cancer was the most common diagnosis among Appalachian women, making up about 40% of their HPV-related cases.
Okay. And for men?
For Appalachian males, the incidence was 13% higher compared to non-Appalachian males. And for them, oropharyngeal cancer, the throat cancer, was overwhelmingly the most frequent. We're talking almost 83% of male cases.
83%. That's huge. So oropharyngeal for men, cervical for women seem to be major drivers. But you mentioned site-specific differences. Did some cancers show even bigger gaps?
Oh, absolutely. This is where some of the numbers get really eye-popping. The single greatest disparity was in vulvar cancer. Rates among Appalachian women were 44% higher than non-Appalachian women.
44%, that's enormous.
It is, and penile cancer incidence was 31% higher in Appalachia. Beyond those, they also found significantly higher rates for both male and female oropharyngeal cancers, female anal cancer, and cervical cancer, as we mentioned.
So quite a few specific types showing much higher rates.
Right. Really, only vaginal cancer and male anal cancer didn't show a statistically significant higher rate in Appalachia compared to elsewhere.
So it's not just more cancer overall, but specific types are disproportionately affecting the region.
Yeah.
What about how advanced these cancers were at diagnosis? Was there a difference there too?
Yes, and this is a really critical point. Late-stage diagnoses, meaning the cancer had already spread, occurred at a 17% higher rate among Appalachian residents.
17% higher for late stage. That's concerning.
Deeply concerning. It suggests people aren't getting diagnosed as early, which, makes treatment tougher and outcomes potentially worse.
That definitely adds another layer of urgency. So this higher rate, these later diagnoses, is this a stable situation, or did the study look at trends over time? Is it getting better or worse?
Unfortunately, the trend data shows the picture is actually worsening in Appalachia relative to the rest of the country.
Oh, no. How so?
Well, looking back over that longer period, 2004 to 2021, the increase in HPV-associated cancer incidence was significantly faster inside Appalachia.
Faster increase.
Yeah. The rate went up by about 1.3% per year in Appalachia compared to only 0.7% per year outside Appalachia.
So the gap is widening.
Essentially, yes. The increase is happening almost twice as fast in the Appalachian region.
Were there specific cancers driving that faster increase?
Yes. The most dramatic trend difference was for penile cancer. Its incidence increased 2.1% faster per year in Appalachia compared to non-Appalachia.
2% faster per year just for penile cancer.
Wow. Female oropharyngeal cancer also increased notably faster, about 1.5% faster per year in Appalachia. And male oropharyngeal cancer increased 0.7% faster per year there.
So the cancers that were already high or common are also the ones increasing faster in many cases. That's a worrying combination.
It really is.
And did the late-stage diagnoses follow that same pattern of accelerating faster in Appalachia?
They did, unfortunately. The rate of late-stage diagnoses also increased faster in Appalachia, about 0.8% per year faster than outside the region.
Okay.
And digging into specifics again, late-stage penile cancer rates among Appalachian men increased more than twice as fast as among non-Appalachian men.
So across the board, higher rates, later diagnoses, and faster increases, especially for certain cancers. It's quite a grim picture for the region.
It paints a very challenging picture, yes. Stark disparities.
So the really big question then is, why? What's driving this? Did the study look within Appalachia itself? Are there differences inside the region?
Yes, they did drill down further, and one finding was that within Appalachia, the incidence rates were actually 11% higher in the non-metropolitan counties, the more rural areas compared to the metropolitan areas.
Okay, so rurality seems to be a factor even within the region. That often correlates with things like access to care, right?
Absolutely. That's often a major challenge in rural settings, fewer doctors, longer travel times, things like that.
Did they identify any specific subregions within Appalachia that were like hotspots?
They did. Looking at that 2017-2021 period again, the North Central and Central subregions had the highest overall HPV-associated cancer rates, around 16.9 cases per 100,000 people.
North, Central, and Central Appalachia. Which states are roughly in those areas?
Those subregions cover parts of Appalachian Kentucky, Ohio, and West Virginia.
Okay. And what do they find specifically about those hotspot regions?
Well, for example, the North Central subregion had the highest rates of male oropharyngeal cancer, and both the Central and North Central areas had significantly higher rates of vulvar, cervical, and penile cancers compared to the other Appalachian subregions.
So the burden isn't evenly spread even within Appalachia.
Not at all. And another really important finding came from the Central subregion. Rates of late-stage cervical cancer were highest there.
Highest late-stage cervical.
Yes, and crucially, those late-stage rates showed a significant increase in the central subregion over time, about 1.7% per year from 2004 to 2021. Meanwhile, they stayed stable in the other subregions.
So something specific seems to be happening with late-stage cervical cancer detection or progression in that particular part of Appalachia.
It certainly suggests localized factors are playing a really important role there. Maybe screening challenges are worsening, or perhaps other factors are driving more advanced disease.
Okay, so we have the stark numbers, the worsening trends, the internal disparities. Now let's try to connect the dots. What reasons did the study authors suggest might be behind all this? What are the contributing factors?
They pointed to several interconnected issues. A big one is historical and ongoing screening deficits.
Meaning people aren't getting recommended cancer screenings.
Exactly. Particularly for cervical cancer, past research has consistently shown lower adherence to screening guidelines in Appalachia and the high rates of late-stage diagnoses we just talked about. That strongly supports the idea that screening isn't catching cancers early enough for many people.
What are the barriers to screening in the region?
Well, the study mentions things like fatalistic beliefs about cancer, a sort of what will be attitude that might discourage prevention efforts.
Yeah.
And also very practical issues like a shortage of clinicians in many areas, fewer doctors and clinics makes access much harder.
Right, the access issue again. What else besides screening?
Tobacco use is another major factor highlighted. Smoking prevalence is significantly higher in Appalachia, especially central Appalachia.
And smoking increases risk for these cancers.
Yes, it's a well-established risk factor for several HPV-associated cancers, including cervical and oropharyngeal, so higher smoking rates likely contribute quite a bit.
Okay, screening deficits, tobacco use, anything else?
They also mention behavioral factors, pointing specifically to indicators of higher risk sexual behaviors, such as the region having disproportionately high rates of teen birth. This suggests broader patterns that might influence HPV transmission.
So it's a complex mix, healthcare access, lifestyle factors, maybe cultural beliefs.
It really is a confluence of factors, it seems, not just one simple explanation.
So given that complexity, what are the ways forward? What does the evidence suggest could help address these disparities?
Well, the absolute cornerstone for primary prevention has to be HPV vaccination. Preventing the infection in the first place is key.
Right. But didn't we say uptake was low in Appalachia?
Exactly. Particularly low in those very subregions, the central and north central areas, that have the highest cancer rates. So boosting vaccination there is critical.
What are the barriers to vaccination specifically?
The study mentions things identified in other research, like a lack of education about the vaccine, why it's important, who should get it, sometimes poor communication between doctors and patients about it,
Okay.
and also persistent fears or concerns among some parents that getting the HPV vaccine might encourage sexual promiscuity in young people. That can be a really significant hurdle to overcome.
So outreach and education are crucial for vaccination. What about for people who might already be infected or at risk? What about screening?
Yes, improved screening is the other major pillar. We definitely need to find ways to increase adherence to cervical cancer screening.
How? Especially with the access issues.
Well, one promising avenue mentioned is exploring options like at-home HPV testing. That could potentially bypass some of the geographic and access barriers for cervical screening.
Ah, that makes sense. Self-collection kits.
Exactly. And beyond cervical cancer, there's ongoing research to develop effective screening tests for oropharyngeal and anal cancers, too. Given the high rates of those in Appalachia, effective screening could eventually make a big difference there as well.
So vaccination and better, maybe more accessible screening are key strategies. This study seems incredibly valuable for highlighting the problem. What did the authors see as its main strengths and weaknesses?
Its biggest strength, really, is its comprehensiveness. Like we said, first time looking at all these cancers across the entire region using high-quality, population-based data covering almost everyone. That provides a really solid, reliable picture.
And limitations. No study is perfect.
Right. They acknowledge a few things. For one, identifying a cancer as HPV-associated based just on the body site isn't proof of HPV infection in every single case, though it's the standard method and a very strong indicator.
Okay.
Also, doing detailed analysis by race and ethnicity was difficult because the Appalachian region overall has relatively low racial and ethnic diversity compared to the whole U.S. And there's always a small chance of misclassifying someone's residence if, say, they moved just before their diagnosis. But these are pretty standard limitations in this type of large-scale registry research.
Understood. So bringing this all home, if you had to distill it down to one core message from this deep dive, what would it be?
I think the unavoidable takeaway is that the Appalachian region is shouldering a significantly heavier burden of HPV-associated cancers, and that burden is actually increasing faster than elsewhere.
And it's not random.
No, not at all. It's a clear reflection of deep, persistent health disparities tied to a whole web of factors, socioeconomic conditions, behaviors, and crucial gaps in healthcare access, like screening and prevention.
It really forces you to think about how much geography and socioeconomic status can dictate health outcomes, doesn't it? Creating these pockets of vulnerability that maybe aren't always visible.
Absolutely. It throws health equity issues into sharp relief.
And maybe leaves us with a provocative thought.
Hmm.
If these kinds of stark disparities exist in a place like Appalachia, which is at least somewhat defined and studied, what other health burdens might be lurking, unexamined, in other underserved communities across the country?
That's a really important question, and perhaps it prompts another one for you, the listener. What more can you do in your own sphere to support efforts for more equitable access? Access to health resources, to reliable information. Not just for HPV, but for all the health challenges that disproportionately affect some communities more than others.
Something definitely worth reflecting on long after this conversation ends.